Good morning, ladies and gentlemen. I'd like to welcome our honorable chief guest, our guest of honor, other dignitaries on the dais, and most important, all the top faculty who have come from all over the country and the delegates also. So I just wanted to update our honorable chief guest. I know all of you know it, but we are discussing on the Glued IOL. So just to update you, sir, the principle here is very simple. If someone has an injury or trauma, or let's say in a consanguineous marriage where the child is born with a lens which is moving, we are not able to fix a lens in the eye. So today with glue or a gum, we are able to fix these lenses inside. The difference is if we take Fevicol, it's a synthetic glue. So I can take two pieces of paper and stick them together. This is natural glue. And I want to tell the media here also, this natural glue is from blood. So it's absolutely safe. Another thing which you thought I'll mention at this stage is on the pinhole pupillasty or the pinhole eye surgery. So to many of the doctors here also, if someone has a cut injury, or today we have also gone to the next stage where people can be avoided a keratoplasty by pinhole surgery. So in this, basically what we are doing is we are doing the iris and making it small to about 1.5 millimeters. So the peripheral rays of light are getting blocked and only the central rays go in and the patient begins to see. So there are many cases like keratoconus where the patient has got conical cornea, or more recently even bad scars of the cornea or corneal opacities. We can avoid surgery like keratoplasty, which has its own complications. So I thought I'll update you on that. I want to thank all of you for coming here, ladies and gentlemen. I deviated off talking a bit lower down so that everybody can understand on what Glued IOL is, pinhole pupillasty are. I want to thank everyone, especially the faculty who have come from every institute, whether it's Shankar Netralia, MM Joshi Center, Arvind, NN, you name the center, they're all here. And I think I have to thank each one of you for this. Thank you so much.
Everybody who's sitting in the audience, thank you for being here. Without you, Reticon would not be possible. And most importantly, people on the dais, absolutely thank you so much for doing this. Good morning. I wanted to introduce Reticon. This is our 15th edition of Reticon. It's taken 15 years to get here. So a small round of applause to everybody who's been part of the 15 years. Back in 2011 when we started Reticon, it was just an initiative started by the Retina Foundation of Agarwal Group. The idea behind this was to basically bring forth cutting edge, new technology, molecules, discussions of a focused area of the eye forward called retina. Over the years, Reticon has consistently showed that cutting edge technology, diagnosis, managing these vitreoretinal disorders, medical and surgical, now even hosting a hands-on wet lab, which is happening right now, where we have over 110 participants registered for that. We also have panel discussions and providing insights into seasoned and non-seasoned retinal budding surgeons across the world. We also have this year virtual talks from Singapore, UAE and US from Bascom Palmer, who are giving their talks on modern cutting edge technology that is coming in the retinal world to our audience who have come from all across India. And thank you so much for being here. I definitely have to extend a heartfelt welcome and thank you to these particular people. Dr. Parveen Sen, who has done exceptional work this year in the Reticon programming and ensuring that we have absolutely brought Reticon to the cutting edge of retina services across the world. Also importantly, chief guest, esteemed Honorable Dr. Kalanidhi Veeraswamy. Thank you, sir, for being here. It's an extreme honor to have known you for all these years and for you to be here as well with us. Thank you so much. Our guest of honor, AIOS Vice President Dr. Mohan Rajan. Thank you so much for being here. It takes a lot. to be so many places at one time, but I think he needs a clone now. And obviously my parents, Dr. and Mrs. Agarwal, they are phenomenal support to me at home as well as at work. So thank you both of you for doing what you do. Dr. Manoj, who's really taken the pillar of DARF, that is Dr. Agarwal Retina Foundation in our main hospital. So thank you for being here. I wanted to most importantly thank the delegates who have woken up on a Sunday morning at 7:30, gotten ready and come here for a Reticon conference so dedicatedly. Being in the hall is no challenge on a Sunday morning, and I can definitely heartfelt warm greetings to everybody here and thank you from the bottom of my heart. Have a great Reticon. Thank you.
When I was invited for this event, I was invited by the staff from Agarwals Eye Hospital. They said that this event was happening and they wanted me to participate. I immediately said yes. And one of the main reasons is because our relationship goes a long way, where my father was a patient and a good friend of Amar's father, and he was treated in the Agarwals Eye Hospital, where he had some retinal problem and laser procedure was done in Agarwals Eye Hospital. And subsequently my father was also instrumental in supporting the hospital, where they had to develop the retina, the laser department, and they had even named one of the laser centers after him, Mr. Veeraswamy Laser Surgery Center, which I had seen earlier prior to it being demolished. So having said that, and the retinal surgery is something which is very little understood by a lot of doctors themselves. Forget about patients. Let's not even talk about patients. When you talk about retinal surgeries or retinal procedures, in about 2 decades back, I think the number of retinal surgeons in Chennai would have been a handful. Probably maybe less than 5 also probably. And one of my friends, he was a retinal surgeon. He was trained in Coimbatore. And through him, I came to know about retinal surgery at a much, much earlier period of time. So, I have seen the evolution of retinal surgeries over the last 2 decades. And earlier, when we are talking about retinal problems, even like I said, many doctors are not aware of the retinal problems which are there. Even MBBS doctors or even physicians, a lot of people are unaware about what problems people can have. And this is especially true because if you look at the life expectancy of people in India, at the time of freedom, an average Indian life expectancy was about around 30 or 35. But today our life expectancy in India is about 70 years. So when we say that average life expectancy is 70 years, it is not very surprising to see people living up to say 100 years or 90 years. So it has become very common. And as people live longer and age, the problems of aging, so the geriatric problems, they start developing. So newer specialties are evolving, and retina is one of those specialties where newer techniques, newer advancements in the procedures are coming, like how Professor Amar had mentioned about the glue facility which is available now. In fact, I remember the days when they used to do a cataract, when they had to make at least half the circumference of the incision had to be about at least half the circumference, and now they are doing it in a pinhole where they are able to remove the lens through pinholes, multiple pinholes, where sutureless cataracts are becoming more popular and being practiced all over the country. And especially when Dr. Mohan Rajan was talking so much about the developments and how they have grown and all those things. He also made one very particular remark about the hug, so which I'm sure that Amar is going to be having an early Diwali this today. He's going to be celebrating Diwali today at his house. So the amount of developments which have happened, like he was talking about the glue which has come up, which is a recent technology where they are able to attach the lens. And in fact, when I was discussing with my friend about the different problems which people have retinal problems, I mean, like most common being diabetes and hypertension, where they have diabetic retinopathy or hypertensive retinopathy. And apart from that, I was also aware that, I mean, like this is a problem of aging, but another problem which many doctors or even obstetricians and pediatricians probably are not aware is about the retinopathy of prematurity. I do not have the statistics of the number of babies who have succumb to this and who are going through problems because of that. But I've understood that if identified and treated early, the symptoms and problems of ROP can be very much, I mean, like restricted, controlled, where they can have better vision and better quality of life. In fact, we have one Tamil saying, saying about the importance of health. I don't know how many people are here from Tamil Nadu. அரிது அரிது மானிடராய் பிறத்தல் அரிது அதனினும் அரிது கூன் குருடு செவிடு பேடு இல்லாமல் பிறத்தல் அரிது. I'll translate that for you. It's very, very rare for you to be born as a human, and even more rare to be born without any defects like blindness, deafness, or kyphoscoliosis or any kind of long-term diseases. So to be having this kind of an opportunity is very rare for people, so which shows the importance of the vision and, I mean, like of course all the other senses, but especially vision. Like if you see the life of a blind person, you will be able to appreciate the problems that they have to go through. And I am happy that Dr. Amar and his wife and his family, everybody is working towards ensuring a blind-free society. And I was told that he has started several branches all over, and in fact his son Ashvin was telling me that in China there is a center where they have about 800 or 1000 clinics spread across whole of China, and I just wish them that they also reach such great numbers to serve the society, and I wish them the best of luck and the best of luck for this conference. Thank you very much.